And I think as a nurse, what I really value is that one-on-one time where I'm there for the patient and I'm just listening to my patient. And I think that can transcend into so many different avenues, whether that's public service, whether that is CEO of a healthcare organization where you're listening to the needs of the people. It's so important. And I think that nursing philosophy, which is so important, we just need more nurses that are in those positions of power. So if you're out there and you're listening, you can do it.
Hello, everyone. I'm Angela Rosa DiDonato.
And I'm Marian Leary.
And you're listening to Amplify Nursing, a Penn nursing podcast supported by the Pinola Fund for Innovation in Nursing.
Amplify Nursing features nurses who are leading the way in science, policy, and innovation.
Our guests defy stereotypes, define practice, and disrupt convention.
We highlight the breadth and depth of nursing influence on society by amplifying nurses who are pushing boundaries and breaking down barriers to build a new paradigm. On this episode of Amplify Nursing, we talk with Tarik Khan, a nurse practitioner, doctoral student at Penn Nursing, and the president of the Pennsylvania State Nurses Association. Tarik's work focuses not just on making his patients' lives better, but on making the profession better, and he does this in a variety of ways, including volunteering on the ground during the pandemic and pushing bills through the state legislature in his role with the PSNA. We talk with him about his work with the Philadelphia Medical Reserve Corps, alongside his mom, a fellow nurse, his goals for the future, and the need to unleash the power of nurses.
So hello, Tarik. Thank you so much for coming on to talk to us today.
Thanks, Angela. It's great being on. Congratulations on season 3 of ANP. This is up there with my favorite podcasts. So Office Ladies and Fresh Air.
Thank you. I really appreciate that. They're really big shoes to fill. Thank you.
Yeah. I mean, if you guys talked more about The Office once in a while, that would be cool too.
Maybe we can work on it for season 4.
That would be great. That'd be great.
Sounds great. So Tarik, how are you? How are things going? I see that you're really, really busy these days.
The next 2 weeks, I'm looking at my calendar, have been just absolutely insane. I had a vaccine clinic that me and my mom staffed on Saturday. We have another one that I'm doing through my health center next Saturday. Staffing rollout yesterday. 2 chapters due last week, 1 chapter due Friday for my dissertation, 2 grants. And then after this, I'm going to TA class. So it has been nuts.
It sounds it. So talk to me a little bit about the vaccination clinics with your mom.
Oh, yeah. So my mom, she's been a nurse 53 years. So I don't feel bad. 53 years. She started out as an LPN, went to Einstein. She actually... She hasn't worked in a clinical setting, I think, since the 80s. I remember when I was a kid, her coming home from Einstein. I remember one day she came home and she had her white nursing shoes and she's like, "Don't touch my shoes," because I guess she had some patient with something in the ER, and I was just staring at the shoes and like I accidentally touched it, and I was like, "Mom, I accidentally touched your shoes. What do I do?" And she's like, "Just wash your hands. It's okay." But she's been out of the clinical setting since then, and in fact, she was ready to not renew her license when it came up. And I said, "Mom, you never know. You never know when you need your license. Just renew it." She said, "I just turned 70." And I said, "Just renew it." So she renewed it, and lo and behold, pandemic. And so she's been like gangbusters volunteering. She started doing flu shots with the Medical Reserve Corps. I had been volunteering with the Medical Reserve Corps since I think April, doing the mass testing site at the Citizens Bank Park. And then I've been doing their testing clinics. And then of course, when they rolled out the vaccines, I was amongst the first healthcare providers to get it from them. And then I've been volunteering every week at their mass vaccination clinics. And that has just been like amazing, that my mom and I are working together. We worked a couple weeks ago, and then we worked last Saturday, giving each other pointers about, best technique. So we can squeeze out like that 7th dose, and my mom is like checking to see how many doses I got out, how many patients I've done. So it's been really, really awesome. And I never thought I would be working like side by side with my mom, and it's it's just great because, my mom is always caring person. I mean, that's why she became a nurse. She encouraged me to become a nurse, but that she's able to actually give back and helping to vaccinate. And she's so good at it. It's like riding a bike, those caring skills that we give so much as nurses. I don't think they ever go away. And I think my mom has just been able to kind of fall back into what she did as an ER nurse and just provide that great care. So it's been really phenomenal working with my mom.
Yeah, that's great. It's so exciting for you to be able to do that.
Oh yeah. It's really cool. It's great. And they actually NBC 10 they did a story on it, and my mom was just so happy. I mean, I was like, Mom, I think I'm going to get you headshots so you can autograph them, because like everyone's like, she is so popular, and I think it's great. But like all the health center staff are like, they're all like, oh, I love your mom, and I'm like, wait, who are you? Sorry, I'm Tarik. Nice to meet you. Because they know my mom, and my mom is like showing them pictures. She's like, she told some people my son is single. I'm like, Mom, don't do that. But she's great. I love her. She's my mom.
That's awesome. We talked about how busy you are. Why don't you talk to us a little bit about what's going on with PSNA these days?
Yeah. So, I was honored to be elected president of PSNA back in the fall. The organization represents, I guess we have about 250,000 nurses in Pennsylvania, and we represent all nurses. And I think historically among all nursing organizations, one thing that we don't often do well as nurses is realize how powerful we are. And there's I don't think there's any blame, but it's sort of like we've never really unleashed the full potential of nursing. And we've been very lucky. PSNA, we have a really dynamic, great person, amazing nurse, Betsy Snook. Her goal is to just get things done for nurses. And our last president, Mark Kreider, one of his strong points was really making sure that nurses' voices were heard. And he PSNA had been a union at one point, and then there was a split, an amicable split around 2000, somewhere around there. And I don't think that split was ever actually, there was never like a rapprochement and say, okay, we're different organizations, but how do we work together? I don't think that ever really happened. In 2009, I actually, the big issue I should say has been staffing. When you talk to nurses and you say, what is your main issue? What is the thing that would affect you on a daily basis that could change? They would tell you it's their staffing. Unfortunately, nurses are overworked. They're working many times in unsafe situations. There's a lot of nursing burnout. And, through the incredible research actually done at Penn, at Chopper, we see what happens when you have safe staffing standards, that fewer patients die. Hospital stays are shorter. There's less readmissions, less falls, healthcare infections. Patients are more satisfied. Nurses are more satisfied. Burnout of nurses is decreased. And so, back in 2009, I actually met with, there were two bills. There was a bill by the nursing unions, and then there was a bill by the Nurses Association. And they were different bills. They were different tracks, and they were really far apart. Over the years, the bills have kind of gotten a little closer to each other. And, my goal, as I said, when I ran for president, was just to really unleash the power of nurses. I was working with the different organizations, the different unions, because, another thing I found out is that when you work with some of these people from other organizations, you realize like how great, like how amazing some of these people are. Usually when you're in the nonprofit sector, when you're in the healthcare sector, you can meet some really amazing people. And these individuals, SEIU Healthcare, PASNAP, Nurses of PA, amazing people, fun, and working together. The professionalism was just outstanding. And I think it really showed when we had our press conference actually yesterday. So today's the February 24th and the 23rd. We had this joint press conference. It's historic because having a professional nursing organization and unions on the same staffing bill, again, staffing is like the age-old problem of nurses feeling like you need two of you to get your job done. I know that's how I felt when I worked in the floors. And I worked at Magnet Hospitals. And so, we've unveiled this bill. It's called the Patient Safety Act. It's House Bill 106, Senate Bill 240. And basically it sets safe patient standards. It sets that floor. So, you can't go less than a certain amount. It does, per the research, allow for adjustment of acuity. So, for example, if your unit is more acute, you're not locked into that fixed ratio. It's not a fixed ratio, but you can't go less than a certain amount. You can lower, instead of a nurse having 4 patients on a tele unit, they could maybe, or med surg unit, they may have 3 patients, but you couldn't say that med surg nurse is not going to have 5 or 6 or 7 patients, which frequently happens. I use the analogy of basketball. You can't have an NBA team if you're going to put 3 guys out on the court instead of 5. Or imagine that if you're a baseball team, you're going to have 2 outfielders and expect to win the World Series. It's not going to happen. Things are going to happen. Mistakes are going to be made, medical errors. And that's what they found. And so I think for us, it's something that we've always wanted to do, to sort of come together on one bill. But the fact that sort of the stars really aligned with our CNO, Chief Nursing Officer, our previous president, my goals and what I ran on, and I was overwhelmingly elected for president, it's something we've been working very closely. So I just to put a cap on it, I think it's going to be, a really historic thing for nurses to have a patient safety bill that will improve their lives on the day-to-day floor. I think it's going to bring nurses back into practice. They saw that in California when they passed the safe staffing bill in California, that actually there was a huge influx of nurses. So all of a sudden you have nurses that are trying to come into the state, nurses that want to work, because who wouldn't want to work at a safe hospital? I mean, one of the reasons why I actually became a full practice provider, I'm an NP, was because I knew that I was not going to be able to last on the floors for 20, 30 years without significant chronic injuries, because that's what happens when there's unsafe staffing, is that you do what you have to do to get by. That chronic stress is unhealthy. The research shows that, and I think we're really proud that we have an evidence-based bill that's going to address that issue.
That's fantastic. And just for those who don't know, the PSNA is the Pennsylvania State Nursing Association. So how has the pandemic increased the need for this bill, Tarik?
I use the example of acute on chronic conditions, like if you have a patient that has congestive heart failure and they come into the hospital with an acute exacerbation. Well, the congestive heart failure isn't new, but the exacerbation, that's landing them in the hospital is new. For nurses, this is the chronic issue of unsafe staffing, and it's just gotten worse. It's gotten worse over the years because of the acuity of patients, cost cutting, and it's really made an unsafe environment for nurses. And then you have the pandemic where we're short on PPE. We have nurses that are getting sick. We have hospitals that are doing staffing freezes during the pandemic. It was true war that these nurses were going into. You would hear these stories we still hear these stories of nurses, and it's like they're going into battle when they go to work. They are putting their lives at risk. They're putting their families' lives at risk. And the fact that, staffing is such an issue. I mean, when you increase the number of patients that a nurse has to have, it significantly increases the chance of death, that a patient is going to die in the shift. Would you want your family to be in a hospital that's unsafe staff? And unfortunately, all too often, this is happening, even in good hospitals. And the reason is there is no standard. There is no standard. I mean, you can have a staffing committee for Magnet, but there's no teeth to that. What happens if they decide, well, we're going to allocate resources in other ways? I think the issue is that, nurses, when they're in administration, they have to actually, they have to go to bat for nurses. And when they're continually told that you guys don't need it, and they're that only voice, it gets really hard for those administrators. But to actually have state standards that say, no, you actually have to have a safe level of staffing on your floor. That's actually going to give cover to our CNOs and our nurse managers to say, you know what, this isn't, not only is it safe to have this level of staffing, it's required by law. And I think that is a win for them as well. At the end, it really is about the patients. It's really protecting the patients to have that level of staffing that you don't have a nurse nurse that, is giving hemodialysis, they have an insulin drip, they've got a patient with major wound care needs, a patient that's unstable. It happens all the time. It happens all the time. And, nurses, they consistently go above and beyond. But again, we talk about acute on chronic. When you're talking about a chronic condition, which is unsafe staffing, and it's just living with a chronic issue, it takes its toll. Nurses are really, they're really in a tough spot. And then we think that, this is what nurses have been asking for. And frankly, we expect legislators to listen to nurses. We've been hearing that nurses are heroes. We respect nurses. We listen to nurses. But this is what nurses are asking for. Nurses, we've actually come together, these different nursing organizations. It's historic to have unions and professional professional nursing organizations. We're the professional nursing organization for the state of Pennsylvania to come together on one staffing bill. And we encourage legislators to do the right thing. And we encourage, listeners and nurses to call their legislators and demand the Patient Safety Act get passed.
I think the average nurse doesn't understand the amount of power that we really could wield in the legislative space if we got together on the same page. As you said, there's 250,000 nurses in Pennsylvania. I mean, what legislator would want to butt up against that?
It's 1% to 2% in every district. So we are the ultimate swing vote.
Yeah.
And I can tell you, one of the great things is working as president of PSNA. And I was, worked on our political action committee. I say worked, but it's volunteer. I don't get paid for this.
I understand.
And I know because you're president of PANA, and it's all volunteer. But nothing beats the heart of a volunteer, right? And the work that is done. I can tell you that this being, advocating for nursing issues has been very nonpartisan, with the exception of the Affordable Care Act, which unfortunately was made political. These are actually things that transcend Democrat, Republican, conservative, liberal. We're talking about safety of patients. We're talking about protecting nurses. We're talking about serving nurses. And that's what we see with legislators too, that we basically, PSNA, we're not Democrat, we're not Republican. We have legislators from every ideology on bills. These nursing issues are nonpartisan. So for nurses that are sort of like on the fence about getting involved and worrying about being too political, these issues, these aren't like these hot button issues. These are actually, these are generally patient safety issues that have a wide range of support. Again, when we talk about staffing, I mean, we went through this staffing bill. I sat down with dozens of nurses to go over the staffing legislation. I didn't have one nurse say, I don't feel right about this, or, I'm against this for some personal, belief. They were all for it. And in fact, some were saying, let's see if we can tighten this up here or this over there a little bit. And in fact, it was because of the input of nurses that we actually strengthened out the bill, that when we were creating it. Absolutely. If we only realized our strength as nurses, we are the largest, provider in the healthcare workforce. There's more nurses than there are physicians, but unfortunately, and I love our physician brothers and sisters, unfortunately, the power structure where they are, it doesn't always represent those needs of physicians. I mean, we look at, full practice authority, for NPs. The Medical Association are our number one critic. But when you talk to physicians about, do you value NPs and do you think that an NP should have full practice authority to practice within the scope of their practice? They would tell you yes. Where the power is held, it's basically, no, NPs are bad. They don't know what they're doing. They're unsafe. I mean, that is what comes from the power. So if we really harnessed our power, I think we could get so much done. And that's why I am really excited, because probably a lot of your listeners don't know, you are the president of PANA, the Nurse Anesthetist Association in Pennsylvania. And you all do incredible work, and you are great partners too, to get together on legislation. So I like, really the sky is the limit. I think what has been holding us back has been just sort of what we've done in the past, which is really not working together. But I think when you see really how much we can get accomplished, when we did that fundraiser for people that were experiencing medical debt. So this was something that we organized, and PANA was along with PSNA and PASNAP. Student nurses at Penn were on it. The PA nurse midwives were on that as well. And if I'm leaving someone out, I apologize. But we raised over $250,000 in medical debt relief. That was nurses. That's something that we did. That impacted the lives of many individuals that were going to get something in the mail that said your medical debt has been forgiven. I mean, and during a pandemic, it's just amazing though that what we can accomplish as nurses. We need more nurses to have seats at the table that are making decisions. Stop me if I'm just
No.
but during the pandemic, I mean, I can't tell you how many times I thought if a nurse was in charge, if we had nurses that were making the decisions, that we would not be in the mess that we're in. I hate to say it, but I think that's the truth. We nurses know what's going on. We spend more time with patients than any other provider. Unfortunately, in some cases, more times than the family, especially during the pandemic. The nurses are there when the patients have been dying. We've had, unfortunately, an awful statistic over, 500,000 Americans were killed by the pandemic in less than a year. And nurses, in many cases, were right there with the patient to comfort them. So nurses know what's going on. Nurses run hospital units. Nurses run nursing homes. And when we're making decisions, it needs to be nurses that are in charge, and nurses that are not only have a seat at the table, which in many cases we don't, but that are making the decisions.
Mm-hmm. Yeah, no, I completely agree. And I think, and you and I have talked about this as well, that one of the downsides of nursing is that historically we don't work well together. We separate into our silos and our own groups, and we don't come together and support each other. We sort of stay to our own. So that's one of the things that I really admire that you've done, is that you've managed to work with the other nursing organizations in order to find something that works well for both groups to push forward, to forward all of nursing. I really commend you for that. That's been a phenomenal lift, I think.
Thank you. Yeah, I mean, when you talk to nurses, they hate the politics. They hate the politics of it. They hate it. And yet you ask, why don't you get involved? A lot of times they say it's the politics. It's the number one turnoff. And this is in general, when people are like, this is my turf, this is not helping patients. This is not helping nurses. So absolutely. But I think also too, give yourself credit to Angela, having people like yourself in these positions of power, good nurses that are caring and listen to each other, and that put, the needs of patients over personal ego, is so critical to having these collaborations. This wouldn't have happened had the leadership, the previous president of PSNA, if Betsy Snook wasn't our president, Maureen May at PASNAP, if she wasn't there, Aaron Triosi, nurses at PA, Jared Smith, Silas Russell at SEIU, PA, if they weren't there, it may be a different story. So we really need good people in these positions, and so that's why it's important, because a lot of these positions are elected. I was elected, you were elected, and so why it's important for people to get involved with the professional organization, because you can make a difference. Some of these elections are decided by like a few votes. I mean, we were astonished when we see presidential elections coming down to 2016. It was about 77,000 votes swung the election. I mean, which is like nothing, right? But when we look at these nursing elections, some of these elections are it's like 3 or 4 votes. I mean, they're not huge. They're not huge numbers. And so that's why it's important for nurses not only to get involved and be active members, have a membership, but also if they think that, they can add something to run, it's so important.
Yeah. Do you ever think you'll segue this volunteer political gig into a real political gig?
I don't know. The reason why I hesitate a little bit is because so many people have told me I should run for something. I am someone that when I see politicians that are not really doing anything, when I see, a legislature that is not really accomplishing things. I mean, I'm not throwing either party under the bus, but in Pennsylvania, we do have the largest legislature, and we pass the fewest amount of bills. If it's something that I see that I can actually make a difference, because I do believe that we do need more nurses in charge on a political level. I mean, we see the impact that even Cori Bush has had from Missouri as a congressperson, the fact that she's had getting a nurse on the COVID-19 task force, and that level of influence. When we have have good public officials that are in a position to make a difference. So I think if I saw that, that there was an opportunity for me to make a difference, I think in my sphere right now, I think I'm very content with. I shouldn't say content because I'm not content, but I think I'm a president of PSNA, which is an amazing organization. Getting my PhD at Penn, God willing, will finish in 2021. Please, God, I just hope it happens. So I'll have my PhD, God willing, and I have an amazing job. I still have it's not full time anymore, but my regular job as a nurse practitioner. I work at a family health center, a nonprofit, federally qualified health center in Nicetown, unrepresentative part of the city of Philadelphia. Mm-hmm. And I love my patients. And so I think if it's something that I would still be able to work in that capacity at the health center to serve my patients, and there was an opportunity that I saw that I could really make a difference, then I would run. It would be something that I have to really look at, because if it's just for my ego of saying, oh, I'm a congressperson, or I'm a senator, or I'm a state rep or a state senator, and it's not really doing anything. It's not really, I'm not really in a position to be fighting for the issues, or if it's not productive, then I wouldn't do it. But it's something that I would definitely look at and see if it was right.
Yeah. They're all really great points, because something always has to give when you're up in the game like that. Yeah.
I mean, in Pennsylvania, we do only have, one state rep who is a nurse, Bridget Kosarowski. We have two state senators, Judy Ward and Maria Collette, our prime sponsor, amazing nurse. In Congress, there's Cori Bush. I think, are there any others? I think is Johnson, is she still Congresswoman Johnson? I'm not sure if she's still in office. I know that Capps stepped down. So we have very few in the Senate, and I'm sorry, in Congress. I don't think we have any in the Senate. Mm-hmm. So, but
Lauren Underwood is.
Oh, Lauren Underwood. Oh, God.
Where's she? Michigan, right?
She is. I think she's Illinois. I may be mistaken.
You're right.
But she is phenomenal. Oh my God! I was hoping that they would choose her for HHS secretary. This is just Tarik, Angela, and Marion talking right now. I mean, it's just like we're just having a conversation. I don't know if the listeners are interested in this, but yeah, Lauren Underwood, man, she is amazing. She is amazing, and I'm so proud. And that's what we need. We need more Lauren Underwoods in positions of power, whether that's elected office, whether that is on boards, whether that's running hospitals and healthcare organizations. We need more nurses. There's no question about it. That philosophy, that care. Because I think that for me, what I really cherish about being a nurse is that it's that one-on-one, it's that care that I'm giving to the patient. When Larry Brown, I'm a huge basketball fan, if you haven't noticed, Sixers fan specifically, when he was coach of the Sixers, there was an article written about him. I think it was by Bill Lyon. And he talked about what Larry Brown liked as a coach was that moment in the gym where it was just him and the player, and they were just working on shots. It was like after everyone had left, and they were just kind of working one-on-one. And I think as a nurse, what I really value is that one-on-one time where I'm there for the patient and I'm just listening to my patient. And I think that can transcend into so many different avenues, whether that's public service, whether that is CEO of a healthcare organization where you're listening to the needs of the people. It's so important. And I think that nursing philosophy, which is so important, we just need more nurses that are in those positions of power. So if you're out there and you're listening, you can do it. Step up. We need you. Your country needs you. And if we've seen during the pandemic anything, is that we need nurses now more than ever.
Yeah, I couldn't agree with you more there. So before we wrap it up, did you want to talk a little bit about your volunteer work with Enabling Minds?
Oh, sure. Yeah. Thanks for asking. This was another thing actually of nurses stepping up. In 2010, after the earthquake, I went with a few nurses to Haiti following that just devastation. And really fell in love with the spirit of the kids and the country. Just an amazing, optimistic, beautiful people in terms of, their spirit, but so much tragedy and hardship in Haiti. It was a slave colony that actually revolted, and they formed their own nation, and it was amazing. It was I think it was 1804. But because of racism, systemic racism, they've gotten the short end of trade policies, of just racism from different countries, and they've really been abused, and it's really affected the nation. And so, it is the poorest country in the Western Hemisphere, and there are neighbors to the south. You could be in Florida and hop on a plane, and I think be there like in an hour or so. It is really close. Our goal was to help, but we wanted to serve a need because it was just a mobile clinic that we were volunteering for. And so one of the things that we knew was unaddressed, and we did a fact-finding trip, was that people with disabilities were very marginalized, unfortunately. Mm-hmm. And in fact, children that had disabilities, for the most part, were not going to school. For public school, we look at lack of funding for the nation to invest in public schools. Public schools, you have to have books, and you have to be able to get there. And if you have a family and you have 4 kids, and you're making $1 or $2 a day, you just don't have that money. And so if you have a child with disabilities, those child in most cases are not going to school. It's very rare, in fact, that children with disabilities are going to school. And so we basically formed a partnership with a private school there to actually start a special ed class that would enroll children in the community that were never in school, to be able to get them educated. So our program is Special Olympics. It provides them with food, provides them, there's a medical clinic and a dental clinic there in the program, and it's across 2 different schools. And there's also kids with disabilities that are sort of integrated with other children as well in other classes. There's about 75 children that we've got in, and so we started it in 2014. So I think this is our 7th year of classes. We've raised over $100,000 to support these children. Everything that we get goes to the school in terms of donations. There's no overhead. We're all volunteers on this side, and then it basically goes to the infrastructure, the currently existing infrastructure where they employ a teacher. It's through the school system, but it's done a lot in terms of the self-efficacy of these children to feel like they're able to accomplish goals. I think also for Haiti is a small country. I think it's the size of Maryland. I may be mistaken. Mm-hmm. And I think population of maybe New York, maybe. I think there's less than 12 million people. It's not a big country. And so things like this, people notice it. And I think they're really helping to shatter some of those illusions about what a person with a disability can do. And so we're continuing to support to raise money for this organization. Me and a few other nurses helped to start it. So it's called Enabling Minds. And if you'd like to make a donation, we would love it. It's enablingminds.com.
Awesome. Thank you. We will definitely post that with us.
Thank you.
Well, yeah, I think this is the perfect place to end. I could talk to you all day long and bore everyone.
We could go another hour.
We certainly could. But it was great to talk to you. I am so inspired by your energy and your commitment to everything that is nursing and making things better for patients. So, thank you for that, and keep going. And I appreciate your representation with PSNA.
Absolutely. Thank you. I appreciate it. And yes, I will keep going because I have to get this chapter to my committee by Friday. Vaccine clinic Saturday. I have a grant this nursing Senate grant to apply for. So yeah, thank you. I will definitely keep going. I appreciate it.
Hello, Angela.
Hello, Marion.
How's it going?
It's amazing. I just had this wonderful conversation with Tarik Khan.
Yes, I am a big fan of Tarik's. And I love that he called the Amplify Nursing podcast ANP. I'm going to have to use that shorthand.
Yeah, I like that too. So Tarik is the current president of the Pennsylvania State Nurses Association. He is a practicing NP. He is a doctoral student at Penn, and he volunteers for organizations on multiple levels. providing support in Haiti, providing support with the Emergency Nurses Corps in Philadelphia. I mean, I don't know what he doesn't do.
Yeah, he's one of those nurses who really not only talks the talk, but walks the walk. And he does it for purely humanitarian reasons, right? He just wants to make the profession better. He wants to make his patients better. He wants to make the world better. And how do you not love that?
Yeah, I could talk to him, and actually I have talked to him for hours about harnessing the power of nursing together as a group. Historically, our professional organizations have not collaborated and worked together. And because of that, we're missing out on the power in the numbers that nurses bring. Tarik pointed out that in Pennsylvania, specifically, there are over 250,000 nurses. They make up 1% to 2% of just about every district in the state, which is a huge voting block.
Yeah, the swing vote. He said it. Like, we are the swing vote. And if nurses understood the power that we have on so many different levels, the changes we could make. And he said it, right? Like, if nurses had been in charge of this pandemic from day one, we'd more than likely be at a different place than where we're at now. And I don't disagree with him.
Yeah, I don't disagree with him either. I think that's been, I totally agree with that. But and as he pointed out, it's not to the detriment of anyone else. It is to show that nurses are the ones who are actually on the ground with the most contact with the patient. So it just makes sense that the group organizing everything with the patient in mind should have been nurses.
Agree.
Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary, and produced by the University of Pennsylvania School of Nursing, with special thanks to our Department of Information Technology Services for their assistance. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter at Penn Nursing. Until next time, keep pushing over, under, around, and through. We want to thank you for listening to the Amplify Nursing podcast and remind you to subscribe to the podcast on iTunes, Google Play, Spotify, or wherever you enjoy your podcast listening. And if you can, please do us a solid and rate and review us as well. It will go a long way in amplifying our episodes.